Hi everybody, Dr. Daniel Yinh at the Center for Musculoskeletal Function in Palm Beach Gardens, Florida, and today we're talking about runner's knee. And runner's knee is basically pain in the front of the knee. So it's an umbrella term to capture pretty much anybody that's having pain in the front of the knee, in particular around the kneecap. Sometimes a little bit off to the side, like an IT band friction syndrome, but mostly right around the kneecap. And that's going to be things like patellofemoral tracking syndrome, or chondromalacia patella, which is the wearing away of the underneath side of the kneecap. So the pain on the kneecap, in the kneecap, or around the kneecap will be covering runner's knee. So some of the movements that make you vulnerable to runner's knee is repetitive bending of the knee or prolonged bending of the knee. So of course running can do that, jumping, plyometrics, say you're box jumping or something like that, that would do that or put you at risk for that. Lunging and kneeling, squatting, and for most of us that work at a desk, sitting for a prolonged period of time can also put a lot of strain on that kneecap. So for that reason, any of these movements are risk factors for runner's knee, and if you do participate in these movements a lot, then incremental exposure until your body can adapt is a good way to try to avoid getting runner's knee. So as runner's knee continues to develop or begins to develop, you might experience pain on daily activities such as navigating up and down stairs or an uneven surface, or from prolonged sitting at work when you go to transition from sitting to standing. And of course, if you're working out and you're feeling pain in the front of the knee with any of these movements, likely you're developing runner's knee. The road to recovery for runner's knee requires that you start eliminating some of the movements that are exacerbating your pain. This is called relative rest. It means you can still work out or be active, but start removing some of the things that you're noticing that are exacerbating your pain. In addition, it's important to get a proper assessment, because not only is the knee important, but the movement and function of the knee is really determined by the hip and pelvis and foot and ankle. So in our exam, for example, we look at all those regions so that we have a complete picture of what is actually contributing to your knee pain. If you found this video helpful, go ahead and give us a thumbs up on YouTube and subscribe to our channel, and we'll see you on the next one. Thank you.